In chapter 21, we are going to focus on the cardiovascular and lymphatic diseases. So first of all, just a quick recap about the lymphatic system. So we talked about it whenever we went over the immune system. But again, our major source of immune cells and fluids, we have those lymphatic vessels that essentially parallel the blood vessels, our arteries and veins. Then we have the lymph nodes, which are clustered throughout the body, and then other accessory organs like the spleen. And ultimately, it's collecting fluids. It's a drainage system, so it filters any impurities and infectious agents and then returns that to the blood. So our defenses of the cardiovascular and lymph system. So this is highly protected from microbial infections because once the microbe gets into the cardiovascular system, it gains access to the entire body and can lead to systemic infections. So we have a lot of defenses in the bloodstream, including those white blood cells, so eosinophils, neutrophils, all of those that are constantly seeking and surveilling within the blood and the lymph. The lymphocytes or B and T cells that are important in the adaptive immunity for cytotoxic T cells and those B cells to make antibodies. Lots of phagocytes that are in there to help with the innate and the adaptive. So again, a lot of defenses packed into that cardiovascular and lymph system. Some terms that go along here. Any condition that involves the blood ends with emia. So viremia would be viruses in the blood, fungemia, fungi in the blood, bacteremia, the presence of bacteria in the blood, septicemia. So we'll talk about sepsis. This one, bacteria are flourishing, so it's not just present, but they are actively growing in the bloodstream. Very serious condition, so it can lead to a drop in the blood pressure and ultimately to septic shock. Now, the normal biota, just like we had seen with the nervous system, this is essentially a closed system, meaning that there is no normal biota in the cardiovascular system. So the presence of any microorganism is going to be transient. It is not meant to be there forever. And again, those immune cells are meant to get rid of it. Now, some more recent data from the microbiome is showing that it's not completely sterile, even in apparently healthy people, that there are some microbes in there. So low levels of infections may contribute to disease in which no infectious cause can be found. And then a loss of diversity in the gut microbiome has been associated with hypertension. So it does seem, again, just looking at indirect effects of the microbiome, that the gut, the bacteria in the gut that are normally there can have an impact on blood pressure and hypertension. So again, for the most part, considered a closed system. However, new research may be indicating there may be some levels of microbes in there, but essentially a closed system. Go ahead and talk about COVID-19 here in this chapter. Even though, of course, it is a respiratory syndrome, we still talk about it here because the virus has a way to access the cardiovascular system, which allows it to become systemic and move throughout the body. So we are focusing on it here. Now, a little bit more about some other coronaviruses. There are 4 others that have been shown to impact humans, again, causing those respiratory infections. There was a different virus outbreak in 2003 that started in China, and then in 2012, there was one in the Middle Eastern countries. Now, the beginning of the pandemic, though, for us in 2019 and then especially into 2020, this is thought to have been the virus that has been circulating for a long time in bats. So it wasn't necessarily thought to be a novel new one, but back to those genetics, it had undergone a few mutations that allowed it to become capable of not only infecting, but multiplying and transmitting in humans. And that was originally contracted in the wildlife market in Wuhan, in China in 2019, of course, leading into the pandemic in 2020. So a little bit about this SARS coronavirus 2. So it's one of 7 members of this family that can infect humans. Again, hundreds more are out there that infect other animals. It is an enveloped RNA virus that has a spike protein. Remember, those spikes are what allow it to attach. It attaches to specific host cell proteins called ACE2. And those proteins then initiate that entry. Because remember, with viruses, the first thing they have to do is attach. So this virus is able to attach to these proteins found in humans. That ACE proteins are found in various places throughout the body. So the lungs, the heart, the kidneys, the liver. It can cross into the placenta and into the GI tract as well. So again, back to that host range of which not only organisms can a virus infect, but also which cells within that organism. So one of the reasons that the coronavirus had so many different types of symptoms in so many different people was because of its ability to attach to these proteins on a variety of cells within the body. Now those particles become airborne, so droplets, as many viruses are transmitted through those respiratory droplets. There are several variants of the coronavirus that we have been talking about. So these mutations, again, allow these variants to form. So the Alpha, Delta, and Omicron. So these, again, provide different changes. So the Alpha made it more contagious. The Delta was more transmissible, also more deadly. The Omicron dominated it to begin with in 2022. So it kind of peaked and then it in 2020 and then kind of went away. And then we had another spike, and it was due to this variation that was a bit unique and immunity had not yet developed. So some of the signs and symptoms, again, prominent respiratory symptoms, but that infection sets off a cytokine storm. Again, immune cells use cytokines as a way of communicating, but that leads to hyperinflammation in the lungs and other organs, including the GI tract. Again, it causes systemic effects. That's why we're focusing on it here. Can lead to rashes, muscle pain, heart damage, joint pain, and blood clots. It's also considered to be neurotropic, just meaning that there is a common loss of taste and smell, so it's able to affect the neurons. Also headaches and even cognitive decline and dementia have been indicated. So up to about 1/3 of the infections, though, are asymptomatic, and many others are mild. And that's one of the very unique things about this virus, is just the variety of impacts it has on different people. So some people, again, very asymptomatic, no problem. Others, it leads to death. So as more and more research is found out, it'll be interesting to see why such variety was seen. Now the prevention and treatment. So mitigation efforts, obviously, the wearing masks, social distancing, hand washing, because again, it's droplets that allow transmission. So just decreasing your exposure to that. Again, emergency approval of 3 vaccines have now been approved. So there was the Pfizer, the BioNTech, and the Moderna. And these consist of an mRNA vaccine. So we talked about these whenever we went through the vaccination. So an mRNA, again, it's the mRNA that's injected into us, that goes into our cells, binds to a ribosome, and makes a protein through translation. So we're not getting the virus. It cannot cause COVID. It's just a piece of messenger RNA that produces a protein. That protein is foreign, so it creates an immune response, and then our antibodies are produced so that we have that immunity. Now, Johnson & Johnson had a slightly different one. They use the adenovirus as a vector. So instead of putting the mRNA in one of those like nanoparticles, so that went into cells, the mRNA was put into an adenovirus. Again, the DNA or RNA from adenovirus was removed, so it wasn't causing a cold or any symptoms from the original virus. It was just using it as a way to attach to our cells so the messenger RNA can get in. And then Paxlovid was then approved in 2021 for patients that had a lot of complications because it improved or showed effectiveness in controlling the infection if it started soon, if it was injected soon after the infection. Right, so just a little bit here about this one again. The coronavirus, variants there. So again, droplets and airborne, ability to attach to those host cells. It can also induce autoimmunity. Again, prevention was through vaccination and just mitigation, so mask and social distancing. Again, that Paxlovid did show to have some effectiveness when given. Again, the key to it, though, was giving it right after symptoms started to appear to kind of mitigate or decrease the infection. Endocarditis is inflammation of the endocardium, which is the inner lining of the heart. It can be acute or subacute endocarditis, so we'll go through both of those. But damage to the heart valves or prosthetic heart valves predisposes patients to this. So again, individuals who have some issues with heart valves are more likely to develop endocarditis than others. Also, it can be caused by vascular trauma, or circulating immune complexes. So again, some type of disease that occurred led to a lot of activation of our immune system, and like antibodies attached to something, they form these complexes and they start kind of clogging the heart or damaging the arteries and the veins, and it can increase chances of getting endocarditis. Now, essentially acute and then subacute endocarditis, as you can see, both of these are caused by multiple different causative agents. So we can see here, so Staph aureus, Strep pyogenes that we've talked about, especially with skin infections. It can also cause acute endocarditis, alpha hemolytic streptococci and others. So again, multiple bacterial infections can occur that can cause an infection of acute or subacute endocarditis. Now, as far as transmission, parenteral mode of transmission is required to develop acute endocarditis. Subacute can be endogenous transfer. So this can be the normal biota. So these are bacteria that typically live there but are transferred to the bloodstream and then can infect that inner lining of the endocardium. As far as prevention, so again with acute aseptic surgery and aseptic injections, because again that's how it gets in, is through some type of injection. So if there's any cross-contamination, can lead to endocarditis. As far as subacute, again, because it's coming from the normal flora, sometimes prophylactic antibiotics are used, just meaning the antibiotic is taken before a surgery or before a surgery to prevent decrease the normal flora before the procedure. So then antibiotics are used as far as treatment for both of these. Now sepsis, which is also called septicemia, we already mentioned earlier, but this is where, again, organisms are actively multiplying in the blood. So not just present, but they're actually having an infection and multiplying. Again, it can be caused by different bacteria or fungi. It causes a variety of symptoms, but fever, mental state, can increase breathing rate, trying to get blood to where it needs to go. Now, endotoxic shock, again, endotoxin is that LPS, so those gram-negative bacteria. Whenever they're multiplying in the blood and they release that lipopolysaccharide, that stimulates a massive inflammatory response. Lots of cytokines get released by those immune cells, and it causes a drastic drop in the blood pressure. Now, gram-positive bacteria can instigate in a similar series of events whenever they release fragments from their cell wall, so like teichoic acid or other unique things to the gram-positive. So again, essentially any type of foreign material that's inside and it overactivates the immune system. We get lots of cytokines, lots of inflammation. That causes a lot of damage to our cardiovascular system. Now, Lyme's disease is another one that we talk about here. So this is becoming more and more common in our area with the transmission with ticks. Its name is because it was first discovered in Old Lyme, Connecticut. So it's been around for a while, since the 70s. It is slow acting but progressive. So its hallmark is this kind of bullseye rash that occurs around the tick bite. Then after that rash, some stiff neck, dizziness, but it does progress. And the reason we're talking about it here is because of those cardiac symptoms. It can also cause neurological symptoms as well, and crippling polio, polyarthritis that it can occur weeks or even months later. Now, the causative agent of Lyme's disease is Borrelia burgdorferi. It is actually a spirochete, so this is one of the only ones that we've talked about here. Again, it has a spiral-like shape. It's not Coccus bacillus. It can have lots of these little coils in it. Its virulence is it can evade the immune system because it changes antigens. So it's constantly changing the proteins and the markers on the cell. So if antibodies are made to one, it produces something else, and now those antibodies don't attack it anymore. So it has multiple proteins that it can use to attach to our host cells. And it's actually possible that the immune response contributes to the pathology. So again, sometimes the inflammation and the response from our immune system does more damage than what the microbe would actually do. And this is an example of that. Our summary table here. So again, causative agent, Borrelia burgdorferi. It is transmitted by those ticks. Again, that antigenic shifting, just the ability to change its antigens, to change the proteins through mutations and changes. Again, its ability to attach to lots of different proteins on our cells. The prevention is avoiding those ticks. So especially when hunting, using, just making sure in the woods or in nature, just making sure that you're checking for ticks. There is treatment. So especially if that rash is seen or tick bites are indicated, antibiotics can be used for several weeks in order to treat the Lyme's disease. Disease, infectious mononucleosis, or typically just called mono. This is caused by Epstein-Barr virus. It actually looks a lot, behaves in even antigens to the herpes virus. So it is a DNA virus that goes in and splices into the host DNA. And again, splicing or integrating just means the DNA, the viral DNA goes in and becomes part of the host DNA. So it becomes latent. And it has the ability to show up in the DNA and hide from the immune response. So it, again, if it hides within our DNA, it's not going to be detected. So more than about 90% of the population has actually been infected by an Epstein-Barr virus. The infections during the teen years usually results in disease more often. So again, many people can be asymptomatic, but those in their teens, typically, whenever they're infected, it does lead to disease state. So our Epstein-Barr virus, so direct contact is often caused the kissing disease, but also it can be transferred indirectly or through injection. Again, virulence, it can integrate into our genome, so it can become latent, and it has the ability to kind of hide then from our immune system. Supportive care is what is used for this. Typically, it is not going to lead to death, so just supportive care during the disease. Our other one here, anthrax. So we mentioned anthrax back whenever we talked about the skin, so cutaneous anthrax. But there are different pathogens here that multiply in the blood, and that leads to septicemic anthrax. So we had cutaneous. This is septic, septemic anthrax. So this is a possible outcome from all the different forms. So there are multiple forms of anthrax, but all of them ultimately can lead to this. It is zoonotic disease of herbivores, so like deer, things that eat plants. The infection, again, is based on the location. So again, we already talked about cutaneous anthrax because it was on the skin. There's pulmonary anthrax in the lung, gastrointestinal, that's in the GI tract, and then anthrax meningitis in our nervous system. Now, the causative agent is Bacillus anthracis. As we mentioned before, this is a spore former, gram-positive, so it can form those spores whenever and move into a dormant state. It is aerobic, so it needs oxygen, and it has the enzyme catalase that is used, so that can be helpful in detecting it as well. But also it forms various toxins. So it forms an edema factor that causes swelling, a protective antigen that makes it look like the host cell, and a lethal factor that causes death, of course. So our summary table here, again, transmission, again, because it can form spores, so it can be inhaled, indirect contact, or even through food. Again, those virulence factors, that triple exotoxin, like the lethal factor and edema factor, so it allows that virulence to occur. There is vaccination for high-risk populations, but typically antibiotics are given post-exposure because it can take a little bit of time before it actually leads to disease for those spores to come out and germinate.